Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India. I would like to welcome you all in my Ayurveda Academy YouTube channel. This video is also a continuation of important Ayurvedic shlokas, recitation, and discussion. Causes of formation of AMA, that is endogenous toxin. AMA utpatti ki karne. Causes of the why this toxin has been generated in the body. AMA concept is very important in Ayurveda because Ayurveda says that many diseases they have the faulty metabolism, faulty digestion, faulty conversion of the food, conversion of the ingested oxygen, water, food, and all these things. Improper conversion. Okay, so that is why this particular arm has been generated. Viruddha anna, viruddha adhyashana ajirana, shilino visharakshana. If you eat viruddhan, incompatible food, that means mixing of the two substances having opposite properties, that is called as a viruddha anna, incompatible food. This is the important cause, especially this creates the cumulative toxicity. वो एकाएक नहीं हो जाता, आप लगातार कुछ सालों बाद वो फॉर एग्जाम्पल फ्रूट जूसेस बोलते हैं ना, मतलब मिल्क शेक, दैट इज वेरी बैड अकॉर्डिंग टू आयुर्वेद एंड ऑफ कोर्स अकॉर्डिंग टू फिजियोलॉजी, because milk is having alkaline in nature and many of the sour fruits are acidic in nature. So if you mix acid and alkali together, that is not a very proper idea for our human digestion. Okay, so that creates the ama, viruddha anna. Okay, next is adhyasana, excessive eating, sweet dish, ice cream, after the heavy dinner, after the heavy lunch, that is not good according to Ayurveda. Ajirana, indigestion, many of the times. This creates amadosham mahagoram varjayet vishasodnyakam. You should avoid all these causes because this ama is like a visha, that means toxin. Next, clinical features of ama. How you can identify that the person is having the disease with some ama content, toxin in the body. स्त्रोतोरोध बलभ्रंश गौरव अनिल मूढ़ता आलस्य पक्तिनिष्ठीव मनस्संग अरुचि क्लमः. These are some of the important features mentioned by Vagbhat. Some are signs and some are symptoms. For example, strotorodha, there will be the obstruction in the different channels. For example, simple rhinitis is obstruction to the nasal passage. Then coronary blockages, this is also the strotorodha. Urinary calculus, this is also the strotorodha. If I'm not getting passing my stools, that is also strotorodha. Okay, balabhrangusha. The particular cells, particular organ, particular system will lose its capacity to work. So bala is the overall loss of strength, physical and mental strength will be lost by the patient. Patient will say, oh, I am feeling tired. I am feeling loss of energy. I do not have any energy. Even some organs, they deny to function. For example, my stomach is heavy and I feel I should not eat now. That is called as a balabhrangusha, loss of strength of my amashay or the intestines or the digestive system. Gaurava, heaviness in the body or heaviness in that particular organ, heaviness in that particular system. Okay, anila mudhata, the vata conduction. Vata is responsible. There are three bioenergies, as you know, vata, pitta, kapha. Vata is a bioenergy responsible for all types of movements, physical level movement, chemical level movement, transport across the cell membrane, then neuromuscular junction, neurotransmitters, then the conduction of the nerve impulse, everything, electrical conductivity of the heart. So that is because of the Vata bioenergy. And these all the activities will be obstructed. That is called as Anila Mudhata. Are you getting my point? So Anila Mudhata doesn't mean only loss of peristalsis. There is a loss of the cell transport mechanism. There is a loss of, say, nerve impulse mechanism. It may be the myasthenia gravis type of problem. Okay. Alasya, again, the laziness of the body, but laziness of the cells, laziness of the organ, laziness of the dhatu. That is the thing. Muscles, they will not very active. You will be feeling, oh, I cannot, I am feeling that I should not move my legs and hands. That is alasya. Okay. Pakti nishtiva. There is a alasya in the digestion process also. Nishtiva is like excessive sputum. Malasanga, most important, constipated tendency. Aruchi, loss of appetite, and klama. Klama is a tiredness but without exertion. There is two terms. That means Balakshay is different, Balabhramshi is different, and Klama is different. Klama is a tiredness, but without any activity. That is called as the Klama in Ayurveda. Next, Sama Vayu. Now there are the features when the Vata, Pitta, and Kapha, they are afflicted with the Ama, what will be the symptoms? And when they are not afflicted with Ama, what will be the symptoms? Sama Vayu, Nirama Vayu. Sama Pitta, Nirama Pitta. Sama Kapha, Nirama Kapha. Okay. Vayuhu Samo Vibandha, where will be obstruction. Agnisada, loss of digestion capacity. Stambha, constriction, stiffness. Antrapujana, loss of peristalsis or excessive peristalsis. Vedana, too much pain anywhere in the body. It may be the abdominal pain, it may be the muscular pain, it may be the musculoskeletal pain, bony pain, everything. Headache, migraine, anything. Shosha, edema will be there. Nistodaihi kramasho angani pidayan. Okay. Vicharet yugapachapi grhnati kupito vrisham snehadir vruddhimapnoti surya megho derishi. This vata will be having more problem when you try to give the snehana treatment. This is a very interesting feature. If the students, doctors are listening my lecture carefully, try to understand what is the difference in Sama Vayu and Nirama Vayu. Actually, the best treatment for Vayu, what is the best treatment? Tell me. Snehana and Svedana. Am I right? Snehana is the oiling, lubrication, and Svedana is the fermentation. But in Ama condition, if you want to apply the oil externally, if you want to give the ghee internally, that fatty substances, giving the fatty substances internally and externally will not be good for the Sama Vayu. The Sneha, Grita and oil, ghee and oil is good. Oil externally, ghee internally is good for Vata. But that is in Nirama Avastha. Without Am, if Vayu is Prakupita, Vayu can be Prakupita in the two ways, Sama Avastha and Nirama Avastha. Sama is a srotorod, Sama is a obstruction, Sama is a toxin, with toxin. So whenever the Vayu is with Samavastha, never use the oil. Never give the sneha dravya to the patient. Is it clear? Okay, ruksha type of the Svedana is indicated. Next, Nirama Vayu. When the Vayu is our Deepana Pachana treatment, you give the carminatives, you give the digestant, you give the appetizers. The best example is a trikatu. Sunta, marich and pippali. Trikatu. Ginger, black pepper and long pepper. This is the Trikatu Ghanavati is available. Best Chitrakadivati is available. These are the best drugs to digest the ama. It is digestant, appetizers, carminative. So use it. What? Trikatu Ghanavati or Chitrakadi Ghanavati. Then Vayu becomes Nirama Vayu. Okay? Niramo Vishado Ruksha. It will be clean, moreover clean. Still it will be having Rukshata. Nirvibandho. There will not be any obstruction. Vedana, Alpa Vedana. Pain will be reduced. Alpa Vedana. Viparita Gunesh Shanti Snigdhari Yati Vishishtaha. The Vata property is Ruksha. That will be controlled with the application of Snigdha. Now here in Nirama Avastha, in Nirama Vayu, you can use the external oil massage and internal ghee treatment. Simple ghee or medicated ghee. This is the understanding. In the Amavastha, you cannot use the oil and ghee. But in Nirama Vayu, Viparita Gunesh Shanti. Because Vayu is dry, you have to give the Snigdha. I hope this is very clear. Fantastic. Sama Vayu, Nirama Vayu. Okay. Next. Sama Pitta. Sama Pitta. Durgandhi. Durgandhi. Harita. Green color. Shava. Pittam. Amlam. Ghanam Guru. It will be heavy to digest, heavy to act. Okay. And mainly when your sputum will come up, it will be like having the green color. Green color in the sputum always indicate infections. And most of the infections, there is a involvement of pitta dosha. And blood will be impure. Blood will be impure. Okay. Amlika kantha hridahakaram. Whenever the mouth water brush will be there, it's like a souring test. And there will be dah, burning sensation in the throat and heart chest region, retrosternal burning. Okay. This is typical feature of the Samapitta. Always there will be foul smell. Green color indicates and also sour taste in the mouth and burning sensation. Amla is a sour. Okay. Next, Nirama Pitta. Niram, without any ama, without toxin. Atamra pittam atyushnam. Still, pitta is hot. Pitta is hot, but it is not with the ama. Rase katukam. Previously, it was a sour taste to the mouth. Now it is a pungent taste. Katu is a pungent. Taste will change. Taste will change when you give the digestant. Taste will change. Next, katukam asthiram patvam vigandhi. Vigandhi. Previously, it was durgandha. Here, vigandhi. No typical foul smell will be there. Ruchi paktri balapradam. Ruchi, appetite will increase. Pakti, digestion will increase. Balapradam, little bit energy will be improved in the Nirama Pitta. Next, Samakafa. Avilas tantras tyanaha. Kantadeshe avatishtade. Usually the Vata is on the lower part of your body. Pitta in the middle part. And Kapha is in the upward part, in the chest and heart and mediastinum. Okay. Avila, tantula, stickiness will be there. Sthyana, like a fiber, springe will be there. Kantha deshe avatishtade. Samo balanam durgandhi. Here also durgandhi, foul smell to your sputum, to your cough, foul smell. Shut udgar vighat. Shut ghat. Shut hunger sensation will be lost. No hunger, no appetite. Udgar is belching, no proper belching. There will be obstruction because of the kapha. This is Sama kapha. Okay. Next, Nirama kapha. Fenavan, Pindita, Pandu. Fenavan. Previously it was sticky. Now it is little bit frothy. Stickiness has been little bit reduced. Okay. Stickiness is reduced. Nissaru agandha. Previously it was durgandha. This is agandha. No gandha, no smell. Smell gone. But Pandu will be there. Little bit anemic condition will be there. Pakvaha sayeva vidneyan chedavan vaktra shuddhi. Your appetite will increase. Your mouth will be little bit more fresh. There will be not any kapha more stickiness over there. Kapha will be there, but not sama kapha. It is a nirama kapha. Okay. As like a dhatu, dosha, dhatu also can be sama and nirama. Rasa, sama rakta, sama mausa, sama medha, sama asti, sama majja, sama shukra is possible. And nirama. So when any dhatu is sama, what will be the condition? Symptoms? Strotorodh, obstruction. For example, rasa rasa and rakta are having ama. Your circulation will be hampered. Circulation is obstructed. A lot of problem. Urea is increased. There is maybe septicemia, septic condition all over the blood. Uremia will be there. Acetone will be there. Ammonia will be there. So a lot of obstructive phenomena will be there. Strotorodha, samadhatu, balabhransha. That particular dhatu will lose its strength. What are the properties of the best function of the dhatu? Prinanam, jivanam, lepaha. Sneho, dharana, purvade. Garbhotpadash dhatu nam, kramasho, angana. Kramasho. Rasa function is a prinana. Prinana will be lost. No energy, lethargic. Rakta, jivan, oxygenation. Oxygen level will drop down. No 100%. Below 80%. Balabhransha. Patient will lose, again, anemic condition will be there, loss of energy. Mausdhatu, muscle wasting will be there. Loss of strength, loss of endurance, loss of tone. Okay? Loss of muscle tone and reflexes will be diminished. Gaurava, heaviness in the body. Anila mudata. I have already explained. Anila, vata dosha. Anila is a vata. Anala is agni. Right. Anila vata. Anala agni. Anila mudata, functions of the vata dosha is hampered. Movement is lost. Physical movements, chemical movements, electrical movements, electronic movements, ionic movements, anything moving, transport across cell membrane, peristaltic movements, heart sounds, lung sounds, loved up, ventricular contraction, like anila mudhata, no proper contraction relaxation. Then your brain will not function properly because neurotransmitters will lost its capacity. No proper nerve conduction. Nerve velocity will be less. Okay. So this nerve conduction, neuromuscular junction, they will lose their power. Okay. That is anila mudhata. Alasya. Again, body cell organ, body cells, dhatu will be lost their energy. Alasya. Pakti. Digestion will not be proper. Nishkiva. Malasanga aruchikrama. I think we have discussed all these conditions of general samavastha, it is related with the dhatu also. Okay, I will not repeat. Samamala, if your purisha, if your stools, if your urine, if your sweat is with the ama, sansrishte vidoshehi tu nyastvam apsu avasidati. Purisham Purushadara Gandhim Pichilam Cha Amasudnyam. I'm very sorry to say, especially when you talk about pathological investigations, this is one of the important investigation in Ayurveda mentioned, that how to check the ama in the Purisha. But I'm very sorry, very few I saw that any reports contains the Sama Purisha Avastha present or not. In any of the pathological report, even in the college, hospital attached to the colleges. I always insist to please do this and give the report. What report? Whether the patient's purisha. Whenever you do the stool examination, you give the report of pus cells. You give the report of parasites, whether it's amoeba present, ova present, cyst present, giardia present, whether even you do the test of occult blood, hidden blood, occult blood. You do all these tests, but you don't do, as you do the acetone test, you do the ring test for the stool. You go and check, but here, Ayurvedic type of the test, especially for the breast milk, stanya and purisha, there is a jala nimajjana pariksha. Right? Jala nimajjana pariksha, sinking at the bottom of the water. Here you can see apsu avasidati. Avasidati to sink down, and other is a floating. If your stool stools is having ama, that stool particles, when you take the water in the test tube and put that stool particles with the stick over there, that all the fragments, all the things will go down immediately at the bottom of the test tube water. But if your stool, purisha, is without ama, then it should flow. It should flow. Okay, so this is typical. Then in the urine also, in the urine, mutra pariksha, there is a typical another type of the taila bindu pariksha. No pathological lab of Ayurveda. If you those who are hearing and seeing my lecture, if anybody knows that you are working in Ayurvedic college, Ayurvedic hospital as a doctor, as a consultant, as a student, as a professor, please write me. Please. I request all of you. Please write me on 9226810630. No, sir, in this article, my name is so XYZ. I am working in the XYZ college. I work in the XYZ hospital, and we do this purisha apsu nimajjana pariksha, jala nimajjana pariksha, stanya jala nimajjana pariksha, urine taila bindu pariksha. We do, sir. This is the report, sir. I am sending you the copies. I will be obliged to him. I will salute him. But I personally feel scarce, very rarely, maybe 0.5% all over the India, the people are doing this. But this is the right platform on the YouTube that I can appeal to all of you. Please do these simple things. Purisha jala nimajjana pariksha, mutra jala nimajjana pariksha. I am sorry, mutra taila bindu pariksha, stanya jala nimajjana pariksha. Please do it. Send it reports to me. I will, with your name, I will publish it on the YouTube. And I will salute you by all the way, from my heart. My viewers are requested to comment immediately on this video. Sir, this right point you have raised. I am a student, I am a professor, I am a consultant, but I have also not seen. Or other, I am doing this. So I want to know your name. I want to know your phone number. Please write me in the comment. Okay? Okay, we will go for this Samamala. So what is the Apsus Avasidati? Then Purisham Bhushadurgandi. Whenever the patient go to the latrine, nobody else want to go around that particular toilet. It's too much smelling. Picture, stickiness, amoebiasis, giardiasis, this is Samamala. Okay? Sama Nirama Vyadhi Lakshan. If the Vyadhi condition is Samavastha, the treatment differs always. Always treatment differs when the Vyadhi is having with Ama and Vyadhi without Ama. Shutnasho. First thing you will understand, the patient loss of appetite. He don't want to eat. Rudaya Ashuddhi. Here in the chest region, he feels little bit clumsy. Rudaya is not exactly heart, the chest region overall. He feels little bit uncomfortable feeling. Ashuddhi. my whole upper part is not very much clear. I cannot breathe properly. I cannot, my heart sound is a little bit irregular. So all these things, Hridaya Ashuddhi, Tandra, drowsiness will be there all of the time. Jatara Gauravai, heaviness in the abdomen. Dosha Pravrittir no. Dosha Pravrittir no. Yatra Vyadhim Amanvitam Vadet. One say this particular author has explained this Sama and Nirama. If you have these lakshanas, this is the Samavastha. If your appetite is normal, there is clean feeling in the chest region, there is no heaviness, all the doshas are working there properly, then Niramavastha. But dosha pravritti, no. What does it mean? All the doshas, for example, pachak pitta. What it should do when you eat, it should come as a type of enzymatic secretions or something like hormone secretions, and they should do their work. In the morning, apanavayu, it should go for the toilet, urine, normal. That is okay. But if you have the constipation, dosha pravritti, no. That means your bioenergies, vata, pitta, kapha, they are not functioning properly. That is dosha pravritti, no. Then that is amavastha. I think at this juncture, at the slide number 54, this shloka video is number 5, my dear friend, 5. Till now, I have completed 4 videos with excellent shloka recitation and discussion. Please support all this series of shloka recitation. Yes, some people are asking me, sir, already there are some shlokas on your YouTube channel. Sir, yes, but that is not without any voice. This is new addition. So I am deleting all the previous, just slides were moving. Many my viewers and fans, they told me, sir, your voice and your energy and your explanation is very good, so please put any shlokas with your explanation. That I like. So that's what I am doing. So please cooperate and subscribe my YouTube channel and share all these type of videos. Thank you very much, and I wish you all the best. See you in the next shloka recitation and discussion video. Thank you very much. Take care.